Hey, my name is Kellie Woodfield. I'm an OBGYN resident at the University of Utah, and this is my poster entitled The Premarital Exam Contextualized Within Adolescent Sexual Health. So premarital exams throughout the Intermountain West have been a point of national attention and controversy in recent years. What occurs during these visits and the intentions of women seeking them are varied and unclear. For some, the approach invokes a patriarchal undertone, so we therefore aim to understand participants' reasons for seeking a premarital exam, their experiences during the exam, and their reflections afterward. We also sought to contextualize emerging themes using the model of adolescent sexual health as a framework, which I will describe in just a minute. So this was a qualitative focus group study conducted from June to July in 2021. Participants self-identified as female and underwent a premarital exam in Utah in the past 5 years. We recruited via social media platforms and community flyers. Groups were conducted virtually over secure Zoom platforms using a semi-structured interview guide, and participants were compensated. We coded focus group transcripts in an iterative manner and identified major themes based onto the codes. We then contextualized these codes using the model of adolescent sexual health as a framework. So the model of adolescent sexual health is a comprehensive model that conceptualizes adolescent sexual health as more than just prevention of risky behaviors. It consists of 4 concentric domains, as you can see in the poster, representing the social constructs surrounding sexuality that both promote and undermine the sexual health of young women. These domains include sociocultural and sociopolitical, social relationships, a person's dating and romantic relationships, and individual factors. So using this model, we evaluated whether premarital exams contribute to or detract from young adult sexual health by categorizing focus group themes as either reinforcing predominant patriarchal discourses or empowering individuals to resist them. We recruited 40 women and held 6 focus groups. The median age of participants was 24. 98% identified as a member of the Church of Jesus Christ of Latter-day Saints, and 90% had a degree beyond high school. We were able to identify themes of both reinforcement and resistance to patriarchal discourses in all domains, except the sociocultural and sociopolitical, which was dominated almost exclusively by patriarchal narratives. Major sociocultural and sociopolitical themes identified were the impact of gendered religious rhetoric and the lack of access to comprehensive sex education. Social relationship themes included the role of female friends and family in encouraging premarital exams and creating an expectation of sex as either pleasurable or painful. Romantic relationship themes included a recognition of the lack of an equivalent male premarital exam. And finally, individual domain themes included varying degrees of sexual body esteem, resistance to gender double standards, dissociation from sexual desire, and self-silencing. So in conclusion, premarital exams are both a product and a propagator of patriarchal discourses within Intermountain West LDS communities, but for some women also serve as a tool to resist and subvert patriarchal narratives in their lives. Despite the misogynistic undertones, these exams serve an important sexual health role for many women, confirming the need for a modernized replacement.